I was looking at Power School and there's little birthday cakes right next to their names. So I'm gonna try to remember to check here when your birthdays are. Are there any questions about the quiz today? No. So just in general, right? So if there's a problem that you have with any of the quiz questions, we can go back over it. I'm more than happy to do that. And we can either discuss it, individual questions, with alone or with a group. It's fine with me. Okay. So, what are you guys in store for next year? Well, next year. Well. So here's the problem that a lot of former students encounter. These quizzes are meant to beat your ass, right? But they're also helpful, right? So this is almost half of the exam, and you're already studying for it. Regardless of how you did, you're already studying for it, unless you didn't look at it at all. Darlene said that she didn't open a book at all. She hasn't opened studied a single thing because she just wants to get me back because she's mad at me for something. No, I'm only joking. So if you're studying and you're improving, that's great. If you're studying and you're not improving, your grades in other words are remaining the same. So then we have to make changes, right? What in my opinion happens is that you guys start studying more. I start getting your attention with these lower grades, and so you start studying more. But then the material starts to get a lot harder. Right? So you're studying more, but the material is getting harder. So what it looks like is that you're running in place, but in reality, you're doing better. Right? Once again, imagine we went back to the quiz, the first couple quizzes. By the way, guys, everyone put your phones away, please. Thank you very much. Imagine the first couple of quizzes, we went back and you're studying this much. How would you do? You probably would do better. Hopefully that same thing is going to happen with the exam. Now, in terms of the exam itself, the exam is going to have 4 main parts. There's the skin and osseous tissue, right? And then the axial skeleton and the appendicular skeleton. And so that's it. I've divided it into 4 different areas. The skeleton is the skeletal system itself. We're doing one of those 4 today. Let me see. And as the schedule would work out, it looks like I really know what the hell I'm doing with the mini practicals, because the mini practical this week is on the axial or the appendicular skeleton. So if you look in Brightspace, there's 3 lecture sets. There's the axial skeleton. It says chapter 7, the axial skeleton, then chapter 7, the pectoral girdle, then chapter 7, the pelvic girdle. So I divided it into 3 different categories. So today we're going to do this part of this one, which is the axial skeleton. So we're only worried about the skull today, and then tomorrow we'll do the vertebrae. So the first part of this, I'm going to spend a little bit of time on these first sets of slides, these first 6 or 7 slides. And then today, and I won't talk about it otherwise, okay? So even if they're repeated, you know that there's the axial and the appendicular skeleton. When we're talking about the appendicular skeleton, it's the pectoral and the pelvic girdle. We're talking about the skull, the vertebral column, principally as in the axial skeleton. I don't really worry about if you know that we have 206 bones, because in reality that's not true. Right? Some people can have more, some people can have less, and you'd be perfectly normal. You should be able to recognize from a skeleton in anatomical position which area of the body we're worried about, and so we're worried about this this area right here, this yellow area, and we'll get into it. Remember, we talked already about the shapes of the bones. Some bones that might be complicated and complex. For instance, this bone right here. What's this bone at the bottom left-hand corner? It's an irregular bone, but what's the name of this bone? It is an SPH. the sphenoid bone. So there's complex bones, there's short bones, there's flat bones, there's long bones, there's also short bones. Here's more of the terminology that we will be using over the course of this week, and we've already been using. Some of this stuff we don't use much at all. I don't use much at all. The hamulus and a lingula are examples of that. A horn is something else. I use it periodically, but there's a lot that we definitely use a lot. More of that. Of the bones that are associated with the skull or adjacent to the skull, there's the hyoid bone. Is a weird little bone that is not, it's interesting because it's hanging off of a bunch of ligaments and muscles, and it doesn't touch anything. So that's one thing. Another 3 bones that are 3 on the left or 3 on the right, 3 on the left are your ossicles. Those are bones that are very small too, and we won't talk about those very much. The ossicles are bones that you'll get back into in A&P2. The first unit in A&P2 is called special senses, and one of those special senses is hearing, and part of the auditory system is those 3 ossicles, the way it functions. So if you look at just the skull here, you have the brain and face, or the neurocranium and the viscerocranium, so you should know those terms. The neurocranium are large flat bones that are surrounding the skull. The viscerocranium are the ones that are much more complicated, much smaller, and anterior facing.
Sorry, I didn't mean to do that. Sorry.
What the hell is
I
that?
dropped my mangoes.
Okay. One thing that I'm going to tell you about, if you look at the sort of the list of these bones here and the list of these bones there, one of the questions that we're going to ask is, here's the bone, which bone or bones articulate with it? So some of these. Some of these bones are large and they have relatively few bones with which they articulate. Others are small and they have lots of bones they articulate with. One thing that is pretty complicated is the frontal bone, not in the sense that the bone itself or recognizing it, but it has lots of bones with which it articulates. Another thing to remember is that those little projections, those holes, those condyles are areas for important articulations or passage of nerves and blood vessels. And then as we get smaller and smaller in the bones, especially the bones of the face here, I don't have a lot of questions about them, and they're certainly going to be hard to identify. So that, for instance, the nasal bone, the lacrimal, the palatine, the vomer, those are hard to identify individually, unless it's in a really clear, colorful drawing. Right? But from a skull perspective, from an inferior view of the skull, those are hard to identify. So I tend to stay away from those, but they might be asked in a more text-based question. And then finally, when we get into the teeth here, we're just going to say they're teeth. We're not worried about individual teeth, whether they're incisors or molars or things like that. This always confuses, not always, this confuses students, and I oftentimes get questions. Wow. If you look at the left-hand, the top of this drawing here, the superior view of the skull, if I put my pointer right there, and I say, which side of the body is this from the drawing here? In other words, this part. Which side of the body is my pointer on?
The right.
This is the right side. Now, if I take this and I turn it upside down, right, so the top part is the frontal bone. If the frontal bone always is anterior, right? So this is always posterior. So now if I turn it upside down, right, that's where people get confused. So at that point, in this view, the body is looking up. In this view, the body is looking down. And so pay attention to that. the direction with which they go. So in terms of the bones themselves, these are easy to identify, but remember the sutures are, there's a sagittal, coronal, and lambdoid suture. You can see a little bit of the lambdoid suture. And those are points of articulation. We won't worry about the structure of those. We'll talk about that in the next unit, in unit 3. First thing to do when you're looking at any of these pictures, whether they're super colorful like this one or just pictures of a skull, make sure you recognize the orientation. Because if you think that we're looking at an anterior view of the skull right now, then then the answers are going to be wrong. So what view of the skull is this?
Posterior.
So posterior. Now, generally when I ask questions here, I often want you to answer the questions by looking up at the drawing here or the diagram. And so I know that it says posterior view of the skull, but sometimes people will say to me, the right side. It's like, well, let's read the label here. So I'm asking you, when I ask questions here, look at the diagram, look around and see if the answer's on the picture. So you can see the sutures here, so you can see some of the squamous suture, you can see the external occipital protuberance. Protuberance is a big bump or a line. It's a big bump or line on the occipital bone, and what do you think that big bump or line is? That's right here. And I don't think the nuchal line is on there. I have it grayed out right here. Again, that's on the list of terms, right, that we're talking about. We should recognize that this is the left side and the right side of the body, and the colors, individual colors are individual bones, right? Now, when we start talking about whether it's a picture or a text-based question, which of the following bones are visible from a lateral view of the skull? Which of the following structures would be visible from a lateral view of the skull? Right, so there's questions like that I'll ask. And that means that you have to remember from without something in front of you, and that might be difficult to do. So if you look at from a lateral view of the skull, a major structure, most obvious thing up superior is the parietal bone, anterior is the frontal, and then the temporal bone is very, very obvious. There's at least 4 or 5 things that are associated with the temporal bone, including the meatus, the zygomatic process of the temporal bone, the mastoid process. You may or may not see the styloid process. Generally, it's behind the mandible. So remember too about the zygomatic arch. The zygomatic arch has 2 parts to it. Oh, so the lights just went off in the hallway. I was like, what the hell's going on? The zygomatic arch has 2 parts to it. It has the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. They combine the 2 of them, they make the zygomatic arch. And then we'll talk in a little bit about the mandible, the only bone in the skull that moves. Except for, well, that's really not quite true. The only bone in the skull that is obviously moving, because the hyoid bone also moves. So here is that lateral view of the skull. Obviously, this is a really simple thing for me to ask about. There's lots of stuff on here. And so, once again, it's your job to go back to the terms in the list that is in Bio 220 or Bio 221 and see if you need to know that. So for instance, have I ever talked about, so the answer to this question is no. Have I ever talked about the nasolacrimal canal? No. So why don't I take it out of there? Well, it's the way this slide is, it's a real pain in the ass to move, to take stuff out. So I haven't gotten to that point. You will see parts of the sphenoid bone there. Basically, the sphenoid bone is visible from virtually any view in the skull. So there are some things that are not relevant on here, and it's your job to recognize that. An anterior view of the skull, you should see some of these major structures at the top, but one that is most obvious here is the orbit, or now the lights are on, the eye orbit, and then the mouth. little bit, I'm gonna give you a blown up view of the eye, and you have to be able to recognize the names of the bones in that area and what they're articulating with. If you look in the posterior view of this here, whoopsie, you have the portion of the greater wing and the lesser wing of the sphenoid bone, and then superior to that is the frontal bone. Inferior and medial is the maxilla, inferior and lateral is zygomatic, and then medial to those are the ethmoid and the lacrimal bone. The one thing that is not involved with the eye is that if you look at where my pointer is the nasal bone. The nasal bone is really, really close, but in fact it stops before it gets to the eye orbit. So if you look at where my pointer is on the, well, first of all, what side of the body is my pointer?
What's the left side?
The left side. So this is, if you're looking on the left side of the body, the pointer, right, we're over right about here, and I'm not on the nasal bone. Okay, so that's why, and I definitely put those questions. Which of the following bones are part of the eye orbit, and I'll put the nasal bone in it, which are not part of the eye orbit, and I'll put the nasal bone. Another view of the skull is the floor of the neurocranium, or the cranial cavity there. The major structure that is obvious there's anteriorly is the frontal bone, but the frontal bone then surrounds the ethmoid bone. And the ethmoid bone, there's this prominent ridge called the crista galli, and that crista galli projects superiorly, and that's where basically a point of attention for the brain. And it's also, there's also holes in the crista galli, and there's holes, that's called the cribriform plate. The cribriform plate has holes that basically it's the horizontal portion of it, and it's got holes in it, and that's where the nerves from the the olfactory nerve goes down. So that's nerves for to smell. And then posterior to that, that's the ethmoid bone. Posterior to that is the pituitary gland, and the pituitary gland has a little saddle, and that saddle is formed by a portion of the sphenoid bone, and it's called the sella turcica. So now, I would not ask you about the pituitary gland. The pituitary gland is sort of important. I would ask you about the sella turcica. Okay, the sella turcica is that saddle-shaped structure. And here is just what I was talking about here. The right-hand side is difficult to identify all the different parts. The left-hand side is much easier. We have the ethmoid bone surrounded by the frontal bone. These holes right here in the frontal bone itself is the frontal sinus. Going posterior from the frontal bone and the frontal sinus here, we have the cribriform plate and the crista galli. We have posterior to that is this lateral view right here. We have, or moving laterally or perpendicular to the length of the body, or is the ethmoid bone, sphenoid bone. The sphenoid bone has the greater wing and the lesser wing, the big wing and the small wing. There's a couple holes that you need to recognize about. There's the superior orbital fissure, the inferior orbital fissure, and the optic canal or the optic foramen. Now, I can ask you about any of those three holes, and even if I show you this picture, right, even if I know that you can't see it, I can still ask you about it. It may not be visible, but which of the following holes would be present on this bone? Right, or following passageways, however I might ask it. Okay. Obviously, the largest and most obvious hole there is the optic. I'm sorry, what hole is this? Foramen magnum, right. And then moving posterior, we have the occipital bone. And by the way, the foramen magnum is right there. Once again, some of these things you don't need to know, others you definitely do. There is parts, especially, there's a lot of stuff to know on the temporal bone, but there's a couple of terms associated with the medial view of the temporal bone versus the lateral view, and so in this case, the medial view is called the petrous part of the temporal bone. You don't need to know that. Here's a better view of this. Now, if I were you, I would go to this slide, I would cut out a piece of paper, I would cover all the, I have this view open, I would cover everything up, right? And I would just start labeling it over and over and over again. That's the best way to do it, or one way, a very good way to do it, regardless of what you're doing there. If you're writing stuff down from memory, that's testing your knowledge. If you're saying, oh yeah, that's the Soloturcica, that's what I thought. Oh yeah, that's the optic canal, that's what I thought. All you're doing is proving to yourself that you can read, right? And I think you can read right now. So if you can read, let's up your game. Let's up our studying habit. Now, let's say you go to this and you go to it and you know it backwards and forwards, right? So then you go to something else and you come back here and then you test yourself again. Then the next level of testing here. Now, you've got music on, you're eating breakfast or dinner or you're having snacks. You have you have something with Netflix on, and you're doing a little bit of math, or you're reading about you're reading something, right? So you're just totally distracted. And then if you do it again and you get it all right, now we're talking. Right? But regardless of the way that you study, you always got to get a time when you make yourself write this down. Right? It's really important. And finally, you need to give yourself the time to do it. So it's Monday. We have a week from tomorrow is the exam. I was talking to my son yesterday. My wife and I were talking to my son yesterday, and he's like, "Dad, I'm really behind for studying." And I said, "Oh, when's your exam?" He's like, "Well, it's coming up on Friday, and I just started on Saturday to study."
Wait, you said you're in the same exact class as us?
Excuse me? No, it's a difference in evolution class. It's a different class. But he said he was behind in his studying. This was Sunday night. He only started studying on Saturday, and he made it so that he's not doing anything else but studying for this exam on Friday. So that's what you're gonna try to have to do. Right? That's what you have to do next year. Now next year you also have a little bit easier because your job next year hopefully is to but to do well in school and to get out in 4 years or less. Right? If you do well in school and you get out in 4 years or less, then you can start working, right? So next year, when you have the capability, you certainly are going to have the time to work more outside of school. Please resist that urge, if you can afford it. Right? Obviously, if you're going to be homeless, if you're starving, right? Your shit happens like that. That's a different question. Right? I told my son he's got a part-time job on campus. I told him I only want him working 10 hours a week, and he told me that those 10 hours a week are keeping him occupied. Right? He's not saving a lot of money from those 10 hours a week, but he's spending a lot of money on beer and other alcohol. Another view, sagittal view of the skull. So we looked at an inferior view, posterior view, anterior view, that superior view of the neurocranium. Here's the neurocranium, the visceral cranium right here. This area right here, we have the sphenoid sinus, the frontal sinus, the two holes that you need to recognize or spaces rather that you need to recognize. This part right here where my pointer is the coronal suture. Can I mark the sagittal suture here? No, I can't really, because this really technically would be the other side would be the sagittal suture. You can see the lambdoid suture. Again, looking at a different view. And I like to ask questions where things are different slightly. This is a bad view of it, or a bad marking, because it looks like you're pointing at the pointer on this. So it looks like that line right there is the styloid process, but there's actually something behind it. That little narrow thing is the styloid process. There's a bunch of bones that are very small right in this area right here, and you can see them in this diagram. And this is probably the easiest place to see them, either at the vomer and the palatine bone. And you can also see the ethmoid bone, a major portion of the ethmoid bone right there. So when you're going to talk about the inferior view of the skull, talk about the major surfaces or stuff that you need to recognize, and you also have to recognize what bones they're on, so that the occipital condyles, the styloid process, the mandible. Now, what is a fossa? A fossa is an area of articulation, and that's rounded. That mandibular fossa is going to be a place where the mandible articulates. And what bone is that part of? The mandibular fossa. What bone does the mandible articulate with? So we're going up here, going up right up here. What bone is articulating right there? There is the TMJ, the temporomandibular joint, right? So the temporal bone. Pterygoid plates are part of the sphenoid bone. The hard palate is anterior, the soft palate is posterior. Generally, I'll be asking about the hard palate, and that's part of the maxilla. Again, there's the inferior view of the skull here, and I think I have that right here, yep. So we have these pterygoid processes right here. These don't get confused with them being the plate. Here, there's still a process and a plate are the same. There's a medial and a lateral pterygoid process right here. We have, there's the bony palate, and this is part of the maxilla, right? We have the zygomatic arch right here. That's very easy to see. This is the zygomatic bone, but it's the temporal process of the zygomatic bone. And this is a zygomatic process of the temporal bone. Okay, so that's that right there. The occipital condyle and the external acoustic occipital protuberance. Let's see. The styloid process is this little narrow thing right here, and it's marked right there. The mastoid process right there. You can see a little bit of the external acoustic meatus or the external acoustic canal. So there can be lots of pictures of skulls of various views. They may be colorized like I have here. They may not be. But if they are not, I recognize that, but you still should be able to see that. So now let's just look at the areas of the eye here. And in terms of the eye itself, there's the following bones that are part of the eye orbit, or the orbit. There are 7 bones right here, and they're listed in the lower left-hand corner here. The sphenoid, the palatine, and the zygomatic, the frontal, ethmoid, and the lacrimal, and the maxilla. Which one of these is most medial? Entire bone is most medial. The lacrimal bone. So which one is most posterior and inferior? I'm sorry, not posterior. Inferior and lateral. Inferior and lateral would be the zygomatic bone. Which one is most posterior? Entirely, that would be the sphenoid bone. How about superior and medial? That would be the frontal. Okay. What role does my pointer play, where my pointer is, in the eye orbit? What bone am I pointing at there? The temporal. So what role does this play in the eye orbit? Do you see the temporal bone here? So there's no role that it plays. It doesn't play any, right? So that's the type of question I could ask too. Right? So the first question will be about the eyes themselves. The second question will be about the 3 major holes that are in there. There's 2 fissures and 1 foramen. There's the medially and formed completely by the sphenoid bone is the optic canal or the optic foramen. There's the superior orbital fissure that's formed by the combination of the lesser wing and the greater wing. The greater wing is inferior, the lesser wing is superior. That's formed again by the sphenoid bone. There's the inferior orbital fissure. It's not very easy to see right here, but the inferior orbital fissure is formed by the greater wing and inferior to that. And then what else? By the maxilla. Okay, so those are definitely things that I can ask. Which of the following bone or bones forms this structure or that structure? We have bones of the nasal cavity. The nasal cavity. Is she out there? So, we don't want any. Bones of the nasal cavity, lots of small bones there. A major bone that is a portion of the nasal cavity is the ethmoid bone. That vertical projection there is called the perpendicular plate. There are these structures called the nasal concave that are formed on the lateral portion of the nasal cavity, and what they help with is respiration and smelling, and they also help with just sort of the respiratory system. So the physical structure of those bones, and I won't worry about those too much because later on in AMP2 you get into those a lot. Sinuses, the two that you need to know are the frontal and the sphenoidal. So now what I'm going to start doing is go through all the individual bones, and then the question becomes, so now we have all the pictures of the skulls. Now I can show you pictures of individual bones. What's this? What's going to articulate with it? Where is it found in the skull? Okay, so there's a lot of questions I can ask there. Right? So there's 3 views at the top right here that you can see the skull, and there's really more than that because you can also then look at the eye orbit and see the frontal bone. The supraorbital foramen and the supraorbital margin are 2 structures that are part of it. There's also the sinus of the frontal bone. Lateral view is the parietal bone. Relatively simple to talk about here. If you look at this part right here, this is the bones of the temporal bone. So you see this part, this thing right here, squamous part and the petrous part. I'm not worried about that. There's a lot of other stuff to worry about in the temporal bone. In particular, the zygomatic process of the temporal bone, that's part of the zygomatic arch. The external acoustic meatus or canal, the styloid process and the mastoid process, and then what articulates with it? What bone that articulates with it that moves?
Mandible.
The mandible. So there's a fossa there, it's called the mandibular fossa. So you can look at these major structures right here that are listed there. Inferior view of the skull, here is the occipital bone. And the condyles, are lateral to the foramen magnum, the occipital condyle. Whenever you have a bump or a ridge, that's probably a point of articulation for something or a point of attachment for something. And in this case, the external acoustic occipital protuberance rather is a point of attachment for, we'll talk about some muscles associated with the head here, so that if you can go like this, if you can raise your eyebrows, I could tell you can. If you can raise your eyebrows, well, those are the muscles that are connecting here. And then you also have a big ligament that's on top of your head, and some of us, you can see the ligament really well. Others, like you guys, can't. And then there's a muscle in the posterior view of your head called the occipital muscle, occipitalis. So that occipitalis is attached to the occipital protuberance, and that muscle, when it contracts, will help pull your eyebrows up or do other things. By far and away, the most complicated bone in the skull is the sphenoid bone. Lots and lots of stuff here, very easy to ask questions about. You can see all of these things that are part of the sphenoid bone right here. In addition, it has something that is hard to visualize, the sphenoid sinus, unless I look at a sagittal view of it. You can see the lesser wing is the superior border of the superior orbital fissure. The greater wing forms the inferior portion of the inferior view. The greater wing is inferior to the lesser wing. So there's lots of questions that I can ask about that. The other thing about the sphenoid bone is it's centrally located within the skull, and it's got lots of different views of it. And If you look on the left-hand side, if you can see this little saddle right here, this is a superior view of the sphenoid bone, and where my pointer is called the sella turcica. I won't ask you this, but it's located where, so that little cup right there, your brain sits on top of it, and then you have a little thing called a pituitary gland that sits right there. And that's where the sella turcica is. But if you can see it, if you can see that little saddle right there, that cradle, that's a superior view. And if you can't see that cradle, that's a different view. In this case, this is a posterior view, and you can also see the anterior view. So a superior view with the cradle and then posterior view down here. Okay, you can see here is the superior orbital fissure. The ethmoid bone is associated a lot with the nasal cavity having the cribriform plate and the crista galli. Those are two main things. The perpendicular plate is another thing. That perpendicular plate is the thing that goes up and down. Up there, and you can see it sticking right there. That perpendicular plate. The zygomatic bone anteriorly projects in the inferior portion of the eye orbit, and then posteriorly projects towards the temporal bone, and it forms the temporal process. So where my pointer is part of the temporal process of the zygomatic arch, but it's on the zygomatic bone. And so it forms so if you put your finger right here in the lower corner of the eye, right there, that's more or less where my pointer is right there, and then we go posterior like that. If we go too far posterior, we're no longer on the zygomatic bone, then we're on the temporal bone. Also, look at these words. Sometimes people get mixed up here. Anterolateral view of wall of the eye orbit, or of the orbit. Dr. Hintz, I've never seen what anterolateral is. Well, you should be able to break it down. What does anterior mean? Anterior. What is lateral? It's side. So sort of in front and on the side. So you're looking at a diagonal. That's what this is saying. Okay, so pay attention to those terminology too. Don't, just because you haven't seen that specific word, when we get to the ischium here, I'll talk about that later on, some other terms associated. Superior view of the mouth, or the oral region, is the maxilla. The maxilla has a couple of things that are associated with it. In particular, there's an infraorbital foramen that's anteriorly. There's the palatine process, and then the zygomatic process. The major structure that we're talking about there are these processes that are for the mouth, for the teeth. Those are called alveolar processes. Palatine bone, I'm not going to ask a lot about. I would not show you a picture like this and ask you what bone it is. I absolutely could show you a picture like this and ask you what bone it is. The lacrimal bone is similarly, I could ask you what bone is this here, right? Is this in relation? So in the eye orbit, but I wouldn't ask you to, I wouldn't take out the, in a picture, take out the lateral bone, put it, and show you what that is. Bridge of the nose is the nasal bone. Back when I was in about your age, I broke my nose. I don't remember how I broke it. But my mother was very upset, and she made me go to the doctor and get a reset. I was like, Mom, what's the big deal? Right. And then, like 2 years later, I was playing basketball in college, and so first of all, imagine me running around, right, for an hour or two. Guess who's bright red, right? That's me. And anyway, so I reach underneath. There's a big, tall guy. Right? He's going like this, and he gets the rebound, and I go to reach up to knock the ball out. And by the way, I stole the ball, so that's good. So I reach up and knock the ball out, and as I'm going like this, his elbow comes down and smashes me right there. And I go, oh man, that hurt. And then I look up. I had both hands like this, and I look up, and I'm like, all I see is red. And I was like, oh shit, I probably should go wash up, right? Mm-hmm. And I mean, there's just blood everywhere. And the guy's like, dude, I'm sorry, man.
It doesn't even hurt, right?
I
And
wouldn't regret it.
what?
Just kidding.
No. So I took my shirt off. I just went like this, and I went. I ended up. I think it broke my nose. I never told my mother, and she didn't make me get it reset. So it's like right there. There's a.
Is this still going?
The only bone that is moving at this point is called the mandible. There's 3 views of the mandible. There's a lateral view, there's a medial view, and an anterior view of the mandible. There's a medial view right here, there's a lateral view right here, and an anterior view right there. Anteriorly, we have the mental foramen. Laterally, we have this structure right here. Right here, there's 2 processes. The anterior process is called the coronoid process. The posterior process is the condylar process. So coronoid and condylar, right? The posterior view is where the mandibular condyle is, and that's the articulation with, what bone articulates right there? The temporal bone. So this is the lateral view. Oh, and then there's the mandibular notch. That mandibular notch is that little saddle between the two. What do you think is the purpose of the coronoid process? Someone give me their favorite finger. If I were to go up to you and go like this and bite down on it, I would demonstrate to you the purpose of the coronoid process. What would happen if I bit down on you really hard, right? It would hurt, right? Elevating the mandible is due to the contractions of muscles. And as I'm saying that, I'm seeing several of you actually practicing that. And I wish I had a video of you guys looking like fish. Because then I would play it to you. Several of you are doing that. But the coronoid process is a point of attachment for contraction of 2 muscles called the temporalis and the masseter. So that's the coronoid process is right there. So the muscle of mastication here, that's chewing. Right here. Now, when we get there, remember when we get to the next unit, we're going to start talking about contractions of muscles. And one thing that people get confused with is that the muscles that pull up, do they push down? No. Right? So now, if this muscle is pulling up on here, right, it's going to elevate the mandible, and then we need a whole other group of muscles that depress the mandible. Which one's going to be stronger? The muscles that elevate the mandible are going to be stronger. The muscles that depress the mandible, that open the mouth, are much weaker. And that's something that's common in the animal kingdom. So if you know anything about dogs, I love dogs. So big dogs like Rottweilers, German Shepherds. I remember my wife and I used to foster a golden retriever. Man, he was built. He was like that. I used to hit him on the head just for the hell of it. And his name was Jack. He was hilarious. No, he was just a brick. He was just, there was nothing that could hit. He was just dumb as dirt. He was also, he had a help us. But he had these massive muscles on the top of his head. And those massive muscles on the top of the head, they all go right to here, and then they elevate. And, I remember one time I was driving out of my little apartment that my wife and I had at the time. We had this little rinky-dink little table in the kitchen, and I drive out, my wife and I are in the car, and I'm like, Jack's tall right now. She's like, yeah, he's really tall. What the hell's happening? And I was like, holy shit, I bet he's standing on the table. He was standing on our table, and he was really tall. He was total goofball, but he was just muscular as hell. He was awesome, dogs. Another thing here is it holds the lower teeth. We're really not going to focus much on the teeth themselves. So if you see where my pointer is right now, this is a medial view of the mandible. Here's a lateral view of the mandible. I think that we have, when we're talking about alveolar processes, that's part of the list of terms that you need to know. Again, now this label right here is not accurate here. This condylar process, really, I would point it right here on where the head is. Right, so I want to distinguish it between there, the condylar and the coronoid process, and the intervening mandibular notch. And then the body and the angle. The angle is the back of the jaw right here, and the body is the main portion of it. Lateral view, medial view. I think that this depression is on this list right here. There's a question at the bottom: which process articulates with the mandibular fossa of the temporal bone? So which process right here? The condylar process, right? Another bone that I really don't ask a lot of questions about, except for identifying just in general, in theory, where they are, is the vomer. Four more bones that are small and very, very difficult to find. Of the three, the biggest is the left-hand side is the hyoid bone. And then on the lower right-hand corner here are the auditory ossicles here. The auditory ossicles are the malleus, the incus, and the stapes. We don't have the anvil, I don't remember what all the names are, the general names here, but there's three auditory ossicles. I won't ask you a lot about them or identifying those pictures right here. If you look on the left-hand side, this is how big they are in relation to a dime, so they're not very big at all. And what they do is they basically, you just line them up in a row here, and so as my voice is projecting out of my mouth, it's hitting your eardrum or your tympanic membrane, and then the tympanic membrane is vibrating, and then it hits one auditory ossicle, then a second one, and a third one, and those three move associated with the tympanic membrane, and as they move, the malleus, the incus, and the stapes then move the deep part of, or the inner ear, and then you convert that into sound, and then you can process that sound. Final point of discussion here we'll talk about here are what does our bone look like, or our skull looks like when it's newborn or developing. First thing is how many frontal bones do we have in this room here? Well, it's one for each person, but when we were a baby and when we were born here, newborn, we had two frontal bones. So that two frontal bones right here had that frontal suture.
Huge heads. Is that why babies have huge heads?
Well, the reason why babies have huge heads is that they have a big brain, right? The reason why the suture here is that the skull hasn't ossified yet. So you can tell how the general age of the baby basically just from an x-ray or from just sort of looking at it. This area right here is the anterior fontanelle, the posterior fontanelle with the sagittal suture in between. That is soon to be the sagittal suture. Technically, this is not the sagittal suture because it's not ossified. A suture is when two bones come together and they're no longer moving. This part right here, the two parietal bones here can move a little bit.
So would it be called like sagittal cartilage?
So I wouldn't ask you about this being what if I asked you to identify this, it would be as an adult, what would this portion of the skull be? Right. So that's what I would ask, because technically this isn't a suture, right? Because again, the suture is when the two bones are ossified. Posterior fontanelle, the anterior fontanelle, you do need to recognize those. What? We're almost done. If you look at the anterior fontanelle, that's by far and away the biggest portion of the skull that is not ossified. I remember when my son was born, and so this is in 2004, before you guys were born, and I'm holding this little guy. I'm trying to figure out how the hell to hold him, because they don't come with directions. Right? Kids don't come with directions. And I was talking to Mrs. Gaspar, and I was saying, how's her husband doing? And she's like, he is struggling. He doesn't know what the hell he's doing. I was like, I feel him, man. First time I ever held a baby, the first time I ever changed a diaper, the first time was in 2004 when my son was born. I was like, my wife thought I was going to break his neck because I was holding him up so high by his feet. I was like, well, I don't know what I'm doing. Anyway, so now at one point I understand how to hold him and stuff, and I'm looking at his head, looking straight down, and he was sort of sleeping in my arms, and I'm like this, and I'm just looking at him, and I could see his skull flexing, the skin moving, and I was like, what the hell was that? At first, because again, I mean, I know in theory, right? I've taught anatomy already, Right, I knew that, but I never saw it in a little kid, right? I never saw it in a newborn. So now the skull is moving. And I was like, what the hell's wrong with my son? And then I look and went, wait a minute here. Oh. And then it was actually blood vessels contracting. And as the blood vessels and the blood is pulsing in his body, right, is moving the skull up and down a little bit. And so that was good, but that's literally what we're talking about here. So that right there, the mastoid fontanelle, I think is on the list there, and this is the soon-to-be lambdoid suture, the soon-to-be the squamous suture, right? In terms of the purpose for this, right, during passage through the birth process, you're allowing the skull to flex and to narrow, and for the skull to be, or the brain to be moved without getting damaged, right? And if you move that much of our skull as adults, right, what would happen would be major brain damage, concussion, right? That would be a major problem. But during the passage through the birth process, we're trying to get it as quickly as we can. What type of feedback would happen if we're talking about moving through the birth process? What type of feedback? Positive or negative? It's positive feedback, right? I want to just sort of remind you about the first, remember chapter 1? So, tomorrow, what we're going to do, we're going to stop right here. Tomorrow, what we're going to do is we're going to go through the 2 parts. First part of the lecture is going to be the vertebral column. We'll finish up the axial skeleton, and then we'll go into the appendicular skeleton. Okay? What?
Why? But doing the transparent sticky notes helped me so much past anatomy with Ms. Minardi.
No, I stole these from the EMT teacher.
So guys, this is supposed to be
It helps.
familiar. The reason
For me,
why
it
I do
does.
the mini practicals is so
I cursed the day that I was born.
I never seen that bone in my life.
We did. In math.
But they're nice for
Right,
tracing,
that's what
I guess.
Yeah.
You also did it in this
And look.
stuff, Miss Minardi's.
Answers.
Exactly. Let me show you where mines are.
Also, I don't think your charger works.
What do you mean? It's not charging?
It wasn't charging my thing.
Probably because of the port. That port does not charge.